Hi. The topic we're going to cover today in holistic health is cardiovascular health, which is chapter 12 from your books. So the cardiovascular system, also known as the circulatory system, delivers blood to all parts of the body. That's its main job. It is made up of red blood cells that carry oxygen, so they're going to transport oxygen and other nutrients to all parts of the body. And also in blood, there's plasma, which will help to transport gases, platelets, which will help to form blood clots or stop someone from bleeding excessively, and white blood cells, which help protect your body from infection. They're part of your immune system. Again, blood is going to deliver nutrients, and it's also going to pick up waste products to help the body get rid of it. Blood also helps to regulate body temperature, and again, clotting will help decrease the chances of losing too much blood, and also helps with healing and tissue repair. Within the heart, that's the main organ of the circulatory system, there are 4 chambers. There are 2 atria, your right and left atrium, and 2 ventricles, right and left again. It's about the size of your fist. It's located on the left side of your chest, just off center of the chest. And the coronary arteries is where the heart itself actually gets its blood supply. The circulatory system can be broken down into arteries and veins. Arteries are the blood vessels that are going to carry oxygenated blood away from the heart. They're the ones that deliver the oxygen to all the different parts of the body. They will then branch into smaller and smaller blood vessels as they get further and further away from the heart. The smaller vessels are called arterioles, and then eventually they will branch into the smallest of the vessels called capillaries. Capillaries are where the gas exchange occurs. Oxygen is put out into the tissues, carbon dioxide and other wastes are transported back into the blood through the capillaries, and then this will turn into the venous system, which will return those wastes back to the heart so that they can be removed. Again, capillaries are going to be the smallest of your blood vessels, the most furthest away from the heart. These are the ones that go into or permeate into the tissues. And again, this is where your gas exchange and your nutrient exchange occurs. So again, oxygen is delivered to the tissues, waste products, carbon dioxide are moved into the blood so that they can be disposed of. And again, that happens through the venous system. So the veins carry deoxygenated blood or the waste products back to the heart so that again, it can be sent to the lungs and then gotten rid of that way. Veins typically have thinner walls than arteries. They're not as strong. They're not as sort of muscular. They have one-way valves in veins that prevent the backflow of blood. Varicose veins are a disorder of the venous system. They're veins that have been stretched and they can't eliminate all the blood that pulls up within them. So they appear large and blue. They sort of protrude from the skin. They're very easily recognizable. So they're distended or stretched veins. They are most often seen in the legs, sometimes in the trunk as well. The chance of developing varicose veins increases with age. Men are more likely to develop varicose veins because they're more likely to have severe venous disease. However, women can develop varicose veins during pregnancy. Risk factors for developing varicose veins include a family history, high blood pressure, and someone who stands for long periods of time. So some very important arteries are the coronary arteries. There are 4 main arteries that arise from the base of the aorta. The aorta is a major blood vessel, and these are the arteries that that deliver oxygen directly to the heart. So these are the ones that are keeping your heart pumping on a regular basis. Again, there are a left and right coronary arteries, and they branch. But again, there's 4 main arteries that are delivering blood to the actual heart muscle itself. And we'll talk about when they get impacted or when they become injured or blocked, what can happen. So some different types of cardiovascular diseases, and we mentioned some of these in some of our previous chapters. So hypertension or chronic high blood pressure is one of them. Stroke is a blood vessel disease of the brain. We'll talk about that a little bit later on in this lecture, what an actual stroke is and how that's affected. But anyone with any type of cardiovascular disease is at an increased risk for having a stroke. Rheumatic heart disease and atherosclerosis, which is a disease of the blood vessels. This is where there is actual thickening or buildup of plaques within the arteries. So that if it affects the coronary arteries, we'll have coronary artery disease. Strokes can also result from atherosclerosis as well. It's a lot to say. About a third of all Americans have one or more form of a cardiovascular disease, and it is the #1 killer of Americans. So atherosclerosis, that is when plaques or fatty deposit develops inside the walls of an artery. It can begin with an injury to the artery lining, which can actually be caused by something like chronic high blood pressure. When someone has blood pressure, high blood pressure, the blood is actually pumping through the artery walls a little harder, and the heart is having to work harder, and that can injure the artery walls. When there is an injury, then plaques can start to develop there, or fatty deposits. So lipids, especially cholesterol, and this is where you hear about people who have high cholesterol and why that's such a problem, they can start to cling, or cholesterol can start to build up on the inside of these artery walls. When the artery walls have a lot of buildup of cholesterol, it gets harder and harder for the blood to pass through, and eventually it can become completely blocked, and then blood can't get through at all, and anything that artery would serve is not going to get proper blood supply. So when we have these injuries and we have these buildups of fatty plaques, scar tissue can then form, and then the arteries become hardened. And again, when the arteries become hardened, the blood can't move through as easily, and so again, anything that's being served by that artery is not going to get the proper nutrition that it needs. The word atherosclerosis actually comes from two different words. An atheroma is a thickened area of the inner lining of an artery, and sclerosis is the hardening of an artery. So we have thickened, hardened arteries, we have buildup of plaque and cholesterol inside, which is going to limit the amount of blood flow that can go through. Here's a picture of what that might look like. So this would be an artery inside of an artery. This would be a normal, healthy artery where blood can easily flow through, and this would be the buildup of that atherosclerotic plaque or cholesterol buildup within the wall of an artery. Blood clots can sometimes form at this site, or if there's a blood clot that's traveled from somewhere else, it can get hung up in this area because it can't fit through. And then that can cause a complete blockage and not allow blood to flow through that artery any longer. Blood clots are often the cause of heart attacks or strokes. So again, a blood clot can be a fatal disorder. We'll talk about in a later slide, but there is a difference in blood clots. There's a thrombus, which is a blood clot that tends to stay in place, and then there can be an embolus, which is one that starts somewhere else and then is on the move. So blood clots can form anywhere, but again, if they travel to a place like the heart or the brain or the lungs, it can have devastating effects. The incidence of atherosclerosis does increase with age, so the older you are, the more likely you are to develop a hardening of the arteries. But again, not all elderly are going to have atherosclerosis. Some young people do, especially with today's diets and increase in obesity and some of those problems that we're facing. So coronary artery disease, when the vessels or the arteries that are supplying blood to the heart itself become blocked, this is what results in a heart attack. So you'll hear the terms like myocardial infarction or heart attack. And again, that's usually because the coronary arteries, those four main arteries that serve the heart, become blocked, and then the heart doesn't get enough blood, and then it can stop beating. And that is, again, the sign of a heart attack, or that's what a heart attack is. One of the warning signs for a heart attack is chest pain, which the technical term is angina pectoris. And so that can be a warning sign. Again, 1 out of every 3 Americans has 1 or more forms of cardiovascular disease. Again, with coronary artery disease, those coronary vessels become partly or completely blocked by either plaque, and it builds up over time and becomes blocked, or a blood clot comes in and gets lodged there, and then that part of the heart no longer gets blood, and it dies, and it stops beating. Peripheral blood vessel disease, those are blockages in organs and tissues other than the heart. Again, I mentioned a thrombus and an embolus. So a thrombus is a stationary blood clot. It can block a blood vessel wherever it forms. It can form in any part of the body. A coronary thrombus is a blood clot that is going to block a coronary artery. An embolus is a blood clot that's on the move. It's floating. And you can have a coronary embolism, so a blood clot travels from wherever it was formed and makes its way to the heart, blocks the artery, and then the heart stops beating. Again, blockage in the coronary arteries or spasm of those arteries, anything that's going to reduce blood flow to the heart is going to result in angina or chest pain. It's felt beneath the breastbone or your chest bone and typically will travel up into the left shoulder and down the left arm. It may also go up into the jaw, or you'll feel it on the left side of your neck, sometimes in the back. Women tend to report back pain more so than chest pain when they're having a heart attack. Angina can be described as aching, squeezing, burning, heaviness, or pressure in the chest. Angina attacks can be brought on by physical exertion or mental or emotional stress. I have a story. My dad was bicycling with some friends, and they're older, but they're in pretty good physical shape. And the one guy that they were biking with, he would notice whenever they'd bike uphill, he noticed his chest hurt a little bit, but like level surfaces downhill, he was completely fine, just walking around, completely fine. Finally decided to go talk to his doctor about it, and here it was exertional angina, which was a sign that he actually did have some blockages to his coronary arteries, and they had to do surgery in order to correct that. So it was a good thing he noticed that, and a good thing he talked to his doctor about it. So with that, angina should never be ignored. It is a sign of some serious cardiovascular disease. So again, here was a guy who was just walking around just fine and had some pretty massive blockages to his coronary arteries. So he was kind of a ticking time bomb that a heart attack could have happened to him at almost any time. So again, he did have some surgery to correct that, and he's doing well now. But they can do some different tests to determine how much blockage is in the heart. And you've probably heard things like, oh, the coronary arteries are like 90% blocked or things like that. And that's what they do. So they can do things like an echocardiogram, which is using ultrasound to kind of take a picture of the heart and how much blood is flowing through the arteries. An angiogram is when they will inject a dye into the blood vessels, and then they'll do an x-ray to kind of see how much of that dye is able to get through the blood vessels. Or they can do an MRI where they put you in the tube and take pictures to determine if there are any blockages to those coronary arteries. So if they determine that there are blockages in the coronary arteries, they have to try to unblock them, right? Because if the blockages continue, again, a chance for a blood clot to form there, or for the artery to just get so blocked that no blood can pass through anymore. So some treatments include an angioplasty. One of the more common forms is a balloon angioplasty. So similar to the angiogram, they will inject a dye or inject like a catheter, a very thin, small tube into the artery, and they'll snake it up to wherever the blockages are. And with the balloon angioplasty, they'll inflate the balloon, that'll break up the plaque, and then it can be sort of recirculated and reabsorbed. There is an atherectomy, which is a cutting-tipped catheter to remove the plaque. So they'll send a different type of catheter up and through the artery, and they'll actually try to break up and remove some of the plaque that way. The next method is a stent. You may have heard of people who have stents placed in their heart, or it's, again, usually the coronary arteries. So this is a mesh device to help keep the artery open. So they use a catheter again. This time they're just threading a stent through, and they find where the blockages are. They place the stent there, and then the stent works to keep the artery walls open so that the blood can continue to travel through. The most, drastic treatment is going to be a coronary artery bypass graft. This is open heart surgery. So this is when they will actually have to do surgery. They will crack open the chest wall, expose the heart. They will take blood vessels from another part of the body. They usually end up taking them from the leg, and they will actually form a bypass. So they'll go from where the blockage is, and they'll reroute the blood flow. Basically, they will stitch on this new vessel, this new vein usually, and then they'll just run it right around where the blockage is and then reattach it down below. And now the blood can flow through the healthy artery instead of the one that was blocked. But that is a major, major surgery for someone to have to go through. Again, about a third to a half of people who have coronary artery disease end up having a heart attack or myocardial infarction. An infarction is an area of tissue that dies because it's not getting enough blood flow and not getting enough oxygen. So it can cause things like arrhythmias or irregular heartbeats, heart failure, cardiac arrest, and eventually death if it's not treated immediately. Congestive heart failure is another type of heart disease, and this is where the heart can't pump effectively, and the veins that are bringing blood back to the heart become overfilled. Causes include coronary artery disease, so if someone has coronary artery disease, they may develop congestive heart failure as well. There are different heart defects where, again, that doesn't allow the heart to pump as it should, and so congestive heart failure can form with that, and rheumatic heart disease is a cause of that as well. Some of the signs of congestive heart failure are shortness of breath, retention of fluid. You usually see a lot of swelling in these individuals, especially in the lower trunk and the legs, congestion of the lungs, and fatigue. Oops. Cardiac arrest or heart attacks. Cardiac arrest just means that the heart stops beating. Immediate defibrillation is needed, so this is where AEDs come into play, and they are found in most public places now. So AEDs, CPR can help keep that person alive until emergency responders arrive. About 380,000 people in the United States have sudden or experience sudden cardiac death each year. So it's quite a bit. Automated external defibrillators, that's what AED stands for. They're used to shock a heart back into rhythm. Most of the ones, and we do have them here on campus if you ever see them, they're out in most public places, grocery stores, doctor's offices, everywhere. Again, many public locations. They're pretty self-explanatory. When you grab one, you open it up and it kind of talks you through the whole process. The American Heart Association does recommend being trained in how to use an AED. It's easy to become CPR and AED certified. There's courses all over the place that are offered almost all the time, and it literally could save someone's life. So again, CPR is going to double or triple a victim's chance of survival. There's a two-step method. Basically, if you notice someone is in cardiac distress, if they're exhibiting any of the symptoms that we're going to talk about on the next slide, it's always the best idea to call 911 first. Get those emergency responders who are the experts in this, get them on their way. And then you can start to perform CPR, or if you have an AED, use one of them to see if shocking the heart is warranted. With CPR, using both hands, push hard and fast in the center of the chest. The idea is to just do something, anything, to keep the blood circulating through their body until emergency help arrives. So signs and symptoms of a heart attack. There's been a lot out there in the media, so I think a lot of people are aware of the signs and symptoms, but they include pressure or heaviness in the chest, shortness of breath or difficulty breathing, a lot of sweating, profuse sweating, weakness, anxiety, and nausea. So feeling sick, and again, very anxious because you're having chest pains, right? The symptoms are often a little more subtle in women. Also, I mentioned earlier that pain that radiates up into the left shoulder, down the left arm, or up into the jaw. Those are telltale signs as well. A stroke, so just as in if the coronary arteries get blocked, a person can have a heart attack. If the arteries that deliver oxygenated blood to the brain become blocked, that person can end up having a stroke, or sometimes called a brain attack. It's the same idea. So a stroke occurs when arteries that supply the brain become blocked, and that prevents blood flow from getting to the brain. It can also happen if a blood vessel in the brain bursts. This would be a cerebral hemorrhage. Either way, the brain is not getting sufficient blood supply, and then that part of the brain dies, and then the person has the symptoms of a stroke. Most strokes happen because of a blockage to blood flow. About 87% of strokes or cerebrovascular accidents are because of lack of oxygenated blood, not because of a cerebral hemorrhage or an aneurysm. An aneurysm is a swollen, weakened blood vessel that may rupture at any time. And then if that happens, there's an excess blood in the area, it puts pressure on the brain, and same thing, that can cause damage to the brain tissue. So that is very similar to a cerebral hemorrhage. Again, most strokes happen because major arteries supplying the brain become blocked. The number of strokes that are occurring in the younger population have significantly increased over the past 20 years, and most medical professionals believe it's due to the fact that obesity is increasing as much as it is in this country. So some of the signs and symptoms of a stroke include weakness, numbness, or paralysis on one side of the body. We call this hemiparesis. So they usually lose feeling or use function of an entire side of the body, like the left side or the right side. A loss or dimming of vision, difficulty with speech, slurring of speech, sudden severe headache, and sudden dizziness, unsteadiness, or episodes of falling. When it comes to stroke, one of the things that they're putting out there now is to think FAST, F-A-S-T, where F stands for facial drooping. So you can see if one side of the face looks like it's drooping, that can be a sign of a stroke. A is for arm weakness. So you have the patient raise both arms out in front and you try to push them down. And if one arm is significantly weaker than the other one, that could be a sign of having a stroke. S stands for slurred speech. So again, if the person is having difficulty speaking. And then T is time to call 911. So quickly get on the phone to 911 and get emergency responders on the way. Some of the treatments or ways to try to prevent a stroke are a carotid endarterectomy. Again, that's a whole lot to say. And that's when they go into the carotid arteries, which are the ones that go right up through your neck here, and they remove the inner lining to try to open up more blood flow getting to the brain. TIAs, or transient ischemic attacks, are small strokes that usually don't cause permanent damage, but they can be signs of a larger stroke that may be impending. Transient ischemic attacks are usually little episodes of the symptoms that we mentioned before: numbness or tingling or weakness on one side of the body, headaches, blurred vision, slurred speech. They come on and then they kind of quickly go away. But again, that's a sign that there might be some blockages in those arteries. Blood thinning drugs may be prescribed as a treatment, and that's just going to, again, allow the blood flow through those arteries a little bit more easily. Emergency treatment for stroke, and again, this is why it's important to get those people to the hospital right away, include clot-dissolving medications. So if it is a blood clot that's formed in one of those arteries, they can try to dissolve it, and that will restore normal blood flow. The quicker you can get the person into treatment, the less serious and less long-lasting the effects of the stroke may be. So some risk factors for cardiovascular disease. We broke these down into modifiable and unmodifiable. Modifiable means these are things that people have control over that you could potentially change. So things like cigarette smoking, obesity, chronic high blood pressure, sedentary lifestyle, diabetes, anxiety, stress. and blood lipids, having high cholesterol. A lot of those things can be changed by diet and activity level. Things that are unmodifiable are things like male gender, increasing age, and a family history of cardiovascular disease. You can't change your family history or your age or your gender. So those are just things we want to try to change, the ones that we can, right? Family history and high blood pressure are actually the biggest risk factors for having cardiovascular disease. And again, really, only one of them is modifiable. So trying to control blood pressure, being active, maintaining a healthy diet so that you don't develop high blood pressure is going to be the best thing that you can do. When it comes to cholesterol or your blood lipids, we break it down into sort of the good and the bad cholesterol. We do want to be aware of our overall cholesterol levels, but it is also important to know about our HDL and our LDL levels as well. HDL is your high density lipoproteins, and this is the good cholesterol. It helps to remove cholesterol from the body, and higher levels of HDL lower your risk of coronary artery disease. LDL, or the bad cholesterol, the low density lipoproteins, these are going to actually carry cholesterol to the cells, allowing it to get into the cells and also start to line and block the arteries. So high levels of LDL actually increase your risk of coronary artery disease. Ideal levels for HDL would be greater than 40, in women even higher, greater than 50, and for LDLs it would be less than 100. So if you ever have blood work and you look at those numbers, that's where we would like them to be. Excess triglycerides, which are plasma lipids that are a little bit different from cholesterol, they are linked to coronary artery disease and stroke in some people. A normal fasting triglyceride level would be less than 150. So again, one of those modifiable factors was cigarette smoking, and this significantly increases the risk of heart attack and stroke 2 to 4 times versus someone who does not smoke. People who smoke tend to have reduced HDL levels and increased LDL levels, which is exactly the opposite of what we want to have. They tend to have an increased level of clotting factors, which means they tend to develop blood clots more easily. And again, if a blood clot gets lodged in one of the arteries, in the heart or the lungs or the brain, again, it can be fatal. The compounds that are in cigarette smoke damage blood vessels and can lead to atherosclerosis, so the hardening of the arteries, which causes the buildup of plaques and then leads to all the other problems. Secondhand smoke is a risk factor as well. And the cause of most heart disease in women is actually linked to cigarette smoking. High blood pressure is another cause of, or a type of cardiovascular disease that can lead to some other health problems. So we do want to be aware of blood pressure. Normal blood pressure is 120/80 millimeters of mercury. Your systolic blood pressure is the pressure that's exerted on the artery walls when the left ventricle contracts, and that's the ventricle that's sending the blood out to the body. Your diastolic blood pressure is the pressure that's exerted on the walls when the left ventricle relaxes. Pre-hypertension is when your systolic pressure, which is the top number, that 120, normal. So a pre-hypertension is when that top number, the systolic number, is between 120 and 139, or the diastolic pressure is between 80 and 89. So just a little bit higher than normal there. Stage 1 hypertension is a systolic reading between 140 and 159, or a diastolic reading of 90 to 99. Diastolic, again, is the bottom number. Stage 2 hypertension is a systolic reading of 160 or more, and a diastolic reading of 100 or more. That's pretty darn high. And persistently high blood pressure contributes to the development of atherosclerosis. So again, the heart is having to work harder and harder to pump that blood, and that's causing a hardening of the arteries. Again, physical activity is a risk factor for developing some of these diseases. Sedentary people are twice as likely to develop coronary artery disease as active people. Again, the CDC recommends at least 150 minutes a week of physical activity, as this will help to lower the risk of heart disease and stroke. More than 75% of American adults don't get enough physical activity, and 25% are not active at all. So again, just a little bit of exercise each day can significantly help to decrease the risk factors for coronary vascular disease. Obesity also doubles the risk of coronary artery disease, and even being mildly overweight increases the risk. Being obese also increases the risk for other diseases such as diabetes, cancer, osteoarthritis. With diabetes, we see elevated blood glucose levels that can cause damage to the heart muscle, the coronary arteries, and some of your major arteries as well. And atherosclerosis occurs more frequently in diabetics, especially in women. Diabetics are 5 times more likely to develop cardiovascular diseases than people who don't have diabetes. Anxiety and stress can cause spasms of the coronary arteries, which can contribute to angina or chest pain. People with anxiety disorders are 2 to 6 times more likely to die from a heart attack as people who don't have anxiety disorders. And elevated C-reactive protein, which is a protein that's produced by the liver during acute inflammation. Elevated C-reactive protein levels can also be a risk factor for CVD. So people who have inflammatory conditions, such as rheumatoid arthritis, are at an increased risk for developing coronary vascular disease or cardiovascular disease. So some ways to maintain cardiovascular health: don't smoke, maintain a healthy weight, get physical activity, exercise regularly, maintain a healthy blood pressure. So even if you have high blood pressure, and sometimes it's passed down in families genetically, I've been given high blood pressure. I try to be physically active, but I still need to take some medicine. So even if you do have high blood pressure, make sure you regularly take your medicine to keep your blood pressure under control. Maintain healthy blood cholesterol levels. So again, eat a well-balanced diet. Eat less fat, more fiber, practice relaxation, and reduce sodium intake as much as you can. And across the lifespan, approximately 1% of babies born each year have a variety of heart and blood vessel abnormalities. Congenital heart defects can often be diagnosed before birth by doing ultrasounds of the mother, and then surgery can be done very early on the baby once they're born to correct any defects. Cardiovascular disease due to atherosclerosis has been shown to begin in childhood. Currently, children in the United States are, while they're getting a balanced diet, are still about 80% of them have too much saturated fat intake in their regular diet, and about 92% too high in sodium intake. And a lot of that is from the processed snack foods that kids eat. This can lead to atherosclerosis and obesity later in life. Elderly should be monitored and treated with lipid-lowering therapy if needed. So those are your cholesterol-lowering medications, and that will help to prevent the progression of cardiovascular disease and other diseases as well. All right, that's it. Let me know if you have any questions. Thanks.